Diabetes doesn't just affect your blood sugar, it can silently damage your nerves and blood vessels, especially in your feet. Unfortunately, many people ignore the early warning signs because of the common misconceptions or myths. Let's bust some of the biggest misconceptions about diabetic foot care.
It's just a small cut on my foot. It'll heal on its own.
Not necessarily. In people with diabetes, even a tiny cut can turn into a serious infection or a non-healing ulcer if circulation is poor or nerve damage is present. We call it diabetic neuropathy. Never ignore a wound that isn't healing.
If my foot doesn't hurt, everything is fine.
That's actually dangerous. Diabetes can damage the nerves in your feet, reducing your ability to feel pain. You may have a deep wound or infection without realizing it.
Applying ointments and home remedies is enough to heal a diabetic foot wound?
No. If blood supply of the foot is reduced, no cream, oil, home remedy can heal the wound. The underlying circulation needs to be evaluated and treated, particularly in non-healing diabetic foot ulcers.
If I have diabetes, losing a foot is inevitable.
Absolutely not. Most amputations can be prevented with early diagnosis, proper wound care, restoring the blood flow when needed, and timely treatment by a vascular specialist.
Only people with uncontrolled diabetes get foot ulcers.
Even people with well-controlled diabetes also can develop foot problems. The longer you have had diabetes, the greater the risk of nerve damage and poor circulation.
Walking barefoot at home is completely safe.
No, it isn't. With diabetic neuropathy, you may step on something sharp or injure your foot without even noticing. Always wear protective diabetic footwear, even indoors, inside house also.
If my wound isn't healing, I just need stronger antibiotics.
Not always. Many diabetic foot wounds don't heal because not enough blood is not reaching to the foot. Without restoring circulation, antibiotics alone may not solve the problem.
Only big wounds are dangerous.
Even a tiny blister, crack or cone can become serious ulcer in a person with diabetes if ignored. That's why daily foot inspection matters.
If my foot becomes black, amputation is the only option.
Not necessarily. In many cases, restoring blood flow through procedures like peripheral angioplasty can save the foot if treatment starts early with control of infection.
Diabetic foot ulcers happen suddenly.
Now, most ulcers develop gradually. They often begin with a small injury, callus, blister or pressure point that goes unnoticed because of the reduced sensation.
I don't need to check my feet every day.
Daily foot examination is one of the most important habits for every person with diabetes. Look for cuts, swelling, redness, blisters, cracks, nail problems or changes in skin color or anything little bit abnormal. Let your vascular surgeon examine your foot.
If my foot feels warm or swollen, it'll settle on its own.
No, a warm, swollen or red foot signal an infection or a serious diabetic foot complication. The earlier it's treated, the better the chances of saving the foot.
Only elderly diabetic patients need to worry about foot problems.
Age isn't the deciding factor. Anyone living with diabetes can develop nerve damage or poorer circulation regardless of the age.
Amputation is the first treatment for diabetic foot.
No, amputation is always the last option. The goal is to save the limb whatever possible through wound care, infection control, improving the blood flow and minimally invasive vascular procedures. So, how many of these misconceptions did you believe? Remember, diabetic foot complications don't happen overnight. They usually begin with small warning signs that are so easy to miss. Check your feet every day. Never ignore a wound that isn't healing and seek medical attention early. The earlier we treat diabetic foot problems, the greater the chances of saving the foot and avoiding the complications. I am Dr. Bhavin Ram. If you found this video helpful, please like, share and subscribe our channel. Further information about any other vascular diseases and its newer treatment.